You're watching TVC Breakfast. Let's get to our first discussion now. In a bid to address the effect of brain drain in the health sector, the federal government is making moves to engage Nigerian doctors and nurses abroad. Minister of Health, Osage Ehanire, who disclosed this to newsmen in Abuja, stated that the aim is to connect the doctors abroad who have acquired more skills to teaching hospitals across Nigeria so they can transfer knowledge. The minister says this way the country will gradually convert the brain drain to brain gain. According to Dr. Hanire, the doctors abroad will hold online lectures with doctors and nurses in the teaching hospitals in Nigeria, and that those who have to do surgery or see a patient in person can book periods during which they will come home with cutting-edge knowledge and skills. The minister added that government is working on improving the condition of services of medical personnel in the country. So joining us on Zoom is the Vice Chairman, Association of Public Health Physicians, Lagos State Chapter, Dr. Alero Roberts. It's nice to have you, Dr. Roberts. Good morning.
Good morning, and thank you for having me. I must make a slight correction. I'm the immediate past second Vice Chairman. We've had a free and fair election, and we've handed over to next.
All right. Thank you very much for that observation. Thank you. Okay. Now, let's get to this issue right now. Do we call this a gain for Nigeria? Because a lot of persons have complained of, not in fact, all Nigerians have been really concerned about the brain drain where medical personnel or doctors, nurses have been leaving the country in droves to the Western countries, to Saudi Arabia, to even to South Africa and some other countries around. Now the government is planning to engage so many doctors abroad, Nigerian doctors and medical practitioners abroad. Do we call this a big gain for the country or for the health sector?
Well, certainly, again, I'm reluctant to call it a big gain until we see what comes out of it. But certainly, this is probably the most effective route we can take at this time. Sense that we certainly can leverage on the technology that is available to get Nigerians abroad, younger generation coming up, because one of the biggest losses we've had with the brain drain is in medical education. There simply aren't enough receptors, doctors, nurses, physiotherapists, pharmacists, medical lab engineers, and medical lab scientists, for the next generation coming in. And we certainly need them to be trained to that minimum standard, which is an international standard.
Right, and the minister is also quoted as saying, Dr. Roberts, that this issue of, brain drain in Nigeria is not immune to the country. It's saying several other countries are also having, people or professionals, medical professionals, in this case now, living, seeking greener pastures. What do you make of that argument when you look at our case here in Nigeria as against or in comparison with other countries?
Well, our situation will certainly continue to be peculiar to us, but you are right. Globally, there is a movement of talent from some areas to other areas. I know that certainly the gaps that have been created for instance, in the UK health sector, because a lot of the UK health workers left the health service, some to greener pastures abroad, paradoxically enough. A lot of them moved to Canada, to Australia, and some just left the service altogether and decided to retire or resign and stay with their welfare packages. And that's what created the gaps, which our healthcare workers are now moving into. So this is going to be a situation. I mean, it is the law of supply and demand. And once an area creates a greener pasture, quote and unquote, people will move in to fill it.
All right. We've had some analysts say that the issue of doctors leaving the country is in practical terms, that it's not as bad as it is reported. I wonder, talk to us and share that with us if it is true that way, or maybe there's something we need to know or have a better grasp of.
You can't blame the government for painting a situation whiter than it ought to. That's what they do. I mean, they have a whole team of spin doctors, who tell you that the situation is not as bad as it is. But tell that to the family members and the relatives, patients who come into hospital, and they see the structure is there, and they see somebody is there, and yet they cannot receive the minimum service they expect to receive to save life and live. They are not going to buy that argument. I mean, the number of times we've had to close down certain areas because we simply don't have the personnel. And right now we're suffering it all. I mean, even for me to get on this program this morning, you recall the amount of discussion it took and me trying to shove things here and there, because each and every one of us in the health sector now has got twice or thrice the amount of workload that we normally ought to have. This is a reality. This is not painting a picture. This is not an imagination. This is a reality we are all facing. We're both delivering service and teaching and trying to carry out research at the same time. You can guess that quality is definitely suffering. I'm not happy with that disingenuous statement, but that's what government does.
Yes, and in charting a way out of where we have found ourselves as a country, and especially in this critical sector of healthcare, where would you, want tackle? What exactly would be the biggest concerns for you in this sector that you want thrashed?
Training the next generation. Training, we need trainers. We need for the training to continue as it is with the ASU strike. Don't forget that this 2022 passed and we were not able to graduate anybody in the health sector. Not a nurse, not a doctor, a pharmacist, physiotherapist, medical, nobody graduated in the health sector. So already we have that gap that has been created. Then we, at the resumption of ASU activities or university activities, a number of staff didn't resume. They had relocated. They have to sort their children out, they have to sort themselves out and be able to provide for their families. So whether that is the biggest gap we have. And unfortunately, it is a gap that is coming on top of an already existing chasm through the decades of underfunding of the educational sector over the years. So that we have very poor training facilities and a very poor training culture. We have the numbers, but we certainly don't have the skills. So I don't know if we can engage Nigerians abroad, and not just doctors. I'm sure the nurses are already being approached and are lining up to be able to give us training in those international standard skills. It'll be at least a step forward in the right direction.
All right. So you talked about training. So do we call this move by the federal government as one of the best moves when it comes to training, if they're going to engage doctors abroad in diaspora to rub minds with the ones we have, all of you back home here? Do we say that the issue of training would have been handled if that happens?
Let's see. Talk is cheap. And right now, all we have heard are the words. Let's see. Because in order to get them to even engage and be able to train our new generation of healthcare workers, the conditions have to be right. And, talk is cheap. This government has been all about talk. Let's see something. Let's see what's going to happen. Let's see because the other thing that I'm now worried about is they create a disparity in remuneration between the diaspora and those available locally. Will those available locally simply fold their hands and say, right, let the diaspora go on? And everybody knows that health service is more than just talk over a Zoom channel. How do you demonstrate the skills? You have to be physically in person to demonstrate the skills. So let's see. Let's see how this is actioned, and then we can talk again in, say, 3-4 months after implementation, if it gets implemented.
Right, and of course, there doesn't seem to be a conclusion yet as to what we need to better the healthcare system in Nigeria. Some say create more facilities, others say upgrade, the existing ones you have, and looking at the lingering deficit of, number of patients to one doctor in Nigeria. What do you really think about this this argument and how our resources can be channeled?
Well, to be honest with you, every functional health facility needs materials, money, and manpower. Without manpower, you can upgrade anything you want to upgrade. You can build any number of health facilities you want to build. Without manpower, functional, effective manpower, you are not going to get the service delivery that is required by the average Nigerian. So we need to look at that issue of manpower. And don't forget, we've been talking about this issue of manpower, if I recall, since 2007. There was a brilliant paper that was written by, I forget his name, I'll tell you in a minute, on the human resources for health in Nigeria. And that was when the deficit then was already quite considerable and has only grown worse over the last decade. So we have to critically address that issue of manpower and use every means. If we make our situation, if we make our country as attractive as others have made theirs, we will reverse the brain drain. People will now start coming in to work in Nigeria. It can be so easily done, but that requires money and materials. But manpower is the critical thing. Without manpower, build any number of health facilities you want to build. They'll just be there, like white elephants, painted and empty, gathering dust, eventually crumbling back to nothing.
All right, let's talk about the welfare of doctors. I recalled through the COVID period, there were lots of complaints from medical practitioners and even the media people who understood, who worked side by side with medical practitioners, seeing what doctors were going through, nurses were going through, all of the extra hours, and juxtaposing it against what government was promising and not meeting up, and even sometimes when they meet up, what they were giving was really meager. Now, the welfare of medical practitioners have been a topic for a period of time. If that has to be upturned for things to be right, where do we really start from? How do we fix that aspect of things?
I mean, that we're still talking about this 38 years after I've graduated is in itself something that I cannot really wrap my head around. And how quickly we all forget. Everybody remarked at the quantum of work that medical health workers were doing. And we were like, this is part of the course. This is what we do. COVID didn't impose anything extra except the strain that the pandemic imposed on the world generally. If we had all the materials, this is what we do. This is how we work. You're on call 24 in every 48 hours, 24 in every 72 hours. And when you come off the call, you only come off the call to resume your new normal duties. It's not that you come off the call and go on holiday for 2 weeks. So this is the way we work in the health sector. How are you going to remunerate it? At least the barest minimum is to make sure that the person doing the work is comfortable. You cannot be handing them peanuts. I cannot have medical workers coming to work in this on public transport that is not even safe in the first place. The minimum we can provide is transportation by any means, safe transportation to take them. And we cannot have nurses who have to spend 4 hours in the traffic getting home from work. When we are talking remuneration, it's not just a pay packet. Do they have good schools for their children that they can afford to send their children to? Do they have decent accommodation, decent transportation? If anything happens to them in the course of doing their work, will their families and children and dependents be taken care of? Are they being catered to? I remember one of the biggest sticking points was insurance for healthcare workers. And we were going back and forth on insurance. Hey, come on. Why won't somebody get up and leave the country to greener pastures when he realizes that, in this country, I'm on my own?
All right. So another way of looking at, this issue we have on our hands. We're having increasing concerns about what's been called the lack of empathy from medical professionals. I mean, look at the grim realities, look at the kind of environment that the average medical personnel works under. It's almost inevitable that, you know, frustration would set in, and they could turn this on patients. Of course, another angle is that even medical personnel are now becoming attacked, increasingly attacked, not even by attackers, by terrorists, but even by families of patients. We've also, you know, seen those reports. What do you make of, you know, this dimension to the issue on our hands?
Well, the human nature is human nature. There's nothing you can do about it. Somebody is stressed, frustrated, and feels undervalued, they're going to react badly. And this is whether you're the patient, your patient's relative, or you're the healthcare worker delivering service. I mean, and I don't mind telling you, work is tiring. When you've been on duty for 10, 12 hours and there's no respite in sight, what do you think is going to happen? We're all human beings. And then, you know, the lack of concern, because people come to the hospital honestly expecting that the fact that they reached the gate of the hospital or the door of the hospital, a miracle is going to happen. For whatever reason, you waited till the patient with a stage 4 metastasized cancer comes in urinary retention. What magic do you think is going to happen? So let's even go back to look at why did the patient's relatives wait till the cancer became a stage 4 metastasized? Because there were no funds or information or resources to bring the patient at an earlier stage in the disease when something meaningful could have been done. When you now bring the patient in, and of course the healthcare worker, the doctor, the nurse are going to look at the patient, and their mind, they look and look, we kill ourselves over this patient, the patient is still going to die in about 30 minutes, 1 hour, or 1 day. The fact of the matter is that the whole system is overburdened and overwhelmed. People are finding that they are having to spend so much money to receive the barest modicum of service, that out-of-pocket expenditure. So they are coming to hospital angry already. They are coming to hospital with all that emotional baggage. Nobody comes to hospital to have fun. They are coming to hospital with all that emotional baggage to meet a team of people who are overworked, tired, not remunerated, wondering how they are going to provide for their own families and expect them to have empathy. Come on, let's get real.
Right, but considering, apologies, Mark, but considering this kind of service that medical officers render, that shouldn't be, you know, a justification, you know, for the lack of empathy.
You are very right. It
right.
should not
And
be
even
a
on the flip side,
justification.
that also shouldn't be a justification for the excesses on the part of, you know, relatives of patients.
I hear you, but what do you think then happens? The medical officer or the nurse simply downs to writes resignation letter, hands it in, forfeit salary in lieu of notice, which is what we are seeing. Which is exactly what we are seeing. Do you know how many times colleagues have called me and said, on my team, we're supposed to be 17, 18, 19, 20. Only 4 people have shown up for work on this shift. What do I do? That is the reality. Because if I know I'm not going to be of any use to a patient, why am I going to work? Besides, even the effort to get to work, I don't have the means or the wherewithal. So that's what's happening. People are simply walking away from the work. That's what needs to be addressed. It's burnout all round.
All right. Do you see the move of the federal government wanting to hire Nigerian doctors abroad as a slight on the doctors back home? Would you see it in that way?
I don't know. It would be a slight if they are now offered the services we have been asking for and not being given, and they are given carte blanche and they can do as they like. Then it can be considered a slight. But if it is a way for the government to at least begin to address the situation and say, okay, What is happening out there? What is the sort of remuneration or welfare package we need to provide? What would make you come back to Nigeria? Then it's a way of getting information and being themselves being taught and trained as to what can be done better. So it can go either way. It depends on, like I said, so far, talk is cheap. Let's see the implementation strategy. Then we can talk again.
Right. So, what are your thoughts on, the recently passed 2023 budget? Reports are saying that we really are not there yet, as against the 15% directive of the budget that that should be given to the health sector. It's going to about 1.23 trillion out of about 21.8 trillion, about 1.23 trillion allocated to the health sector. What are your thoughts on that? How sufficient? How can that really go around across the states under the federal government's mandate, of course?
I am going to do the typical thing and answer a question with a question. The fact of the matter is that, does it constitute 15% of the budget? Because this wasn't a number just plucked out of the air. This was a number that was deliberated upon by a whole team of professionals from across the continent that just happened to have been held in Abuja. It wasn't a number plucked out. 15% is not 13%. 15% is not 12%. In many cases, I think the highest we have ever reached is 7% of the budget. This year, we have certainly not met that. I stand to be corrected. I'm not a finance expert by any means, but I don't see how less than 15% is going to meet the need that 15% can meet. And we're not just talking about remuneration, we're talking about every other thing that goes into the health sector. So until we reach 15%, at least, and that was an at least, that was a minimum standard. I don't know what we're talking about. We're just pretending, really.
All right. Seeing that we have consistently expressed dissatisfaction with the budgetary allocation to health, the attention on the health sector, and making doctors to even leave abroad. Does this also impact on the number of enrollment into the medical profession? Are you noticing anything like that?
Well, I can't say for certain. It's a bit difficult to answer that because you see, enrollment into the health sector, as it were, is enrollment into training institutions. And training institutions are only permitted to take on the number of students for which they have educators and preceptors. So, if you have 10 teachers, you cannot take on the same number of students as an institution that has, say, 100 teachers. So whether the enrollment is because of the dwindling number of educators or the enrollment is because people are really not interested in the health sector, it is a bit difficult to say without more complete data.
Dr. Roberts, last week, we also got reports of an impending strike. The National Association of Resident Doctors are also threatening to embark on a strike. When they say they will decide on this, they will hear the final verdict from their members when they meet about this week or the next. So at a point, people were even saying that, okay, thankfully, the nation was spared from, medical doctor strikes and other strikes within the health sector. But with this warning now, what do you make of it?
I keep saying it, how quickly we all forget. There has never been a resident doctor strike that can be called spurious or unnecessary. Let me break it down like this, because I think if we bring the other side of the story and we personalize it, maybe we can understand it a little bit. I recall with painful clarity when I had been called for an issue, and as I drove into the hospital, there was a young doctor standing at the door saying, here is the patient, I am here, the facility is here, and I do not have the materials to work with to save life and life. What am I doing here? I mean, that question for me encapsulated everything that doctors and nurses and teachers have been fighting for in this country for decades. It didn't just start today. We cannot continue to be giving people false hope that because they've made it to the door of the hospital and Eureka, there's a doctor and a nurse and a medical records officer, I am going to get what I need. And then the next thing they get is an entire shopping list running into tens and thousands of naira before even the minimum can be done to save life and live. We can't continue to deceive people. It's what's making so many people simply walk away. And this is the reality. This is not an imagination. This is not then say. This is what is going on. I just spoke with another young doctor. She's come back from serving in a state in the southeast zone, where she was the only doctor in a religious mission hospital. And she was shocked to see children still dying of malnutrition, still dying of diarrheal disease. And that the mothers didn't even know the minimum that they could do. They didn't even know the place where they could go. Many had traveled for miles. This is the reality of what we are talking about. And she said she had to leave there because she was there, but she didn't have materials to work with. And this is when you drill down to the reason why resident doctors are going on strike, you will find it all boils down to it's not just enough for us to be here. It's not just enough for us to train. If we don't have the materials and the wherewithal to work, what do you expect us to do?
All right, we have to leave it here now. It's really, the picture you have painted for us is really one that it's troubling, but we just hope that the authorities and those concerned will do something about this drastically. Thank you so much, Dr. Alero Roberts, public health physician. Thank you for talking to us this morning, and thanks for your insight.
I hope it won't be just talk the next time we come around. I
really hope
some
so.
Positive results.
Yes, we really hope so. Thank you very much.